for 5 minutes.
Thank you, Chairman, and thanks to you and the ranking member for hosting this today. Thank you all for being here. I represent the Buffalo-Niagara region, which is home to Western New York's VA healthcare system and one of only 2 post-9/11 GI Bill processing centers. For years, workforce shortages at both the Veterans Benefits Administration Regional Office and the Buffalo VA Medical Center have been severe and persistent, particularly in primary care, mental health, urology, gastroenterology, and endocrinology. I've seen how understaffing at the VA affects veterans and their families. It means longer wait times, delayed care, and real consequences for those who rely on these services. In August 2024, dozens of nurses gathered outside the Buffalo VA to protest pay disparities, excessive work hours, and the VA's hiring freeze. They warned that these severe staffing shortages jeopardize patient safety and undermine the VA's commitment to providing high-quality care for our nation's bravest. Those warnings were echoed weeks later when the VA's OIG September 2024 report titled Community Care Consult Delays Despite Staff Advocacy Efforts at the VA Western New York Healthcare System in Buffalo. The report found that staffing shortages in both administrative and clinical settings led to delayed consult and appointments, leaving our heroes without the care they need, including ones who were hospitalized and others who were tragically passed as a result. Despite those known challenges, conditions have continued to deteriorate at the hands of this administration. At the end of 2024, the VA reported 40,000 vacancies nationwide. Rather than filling those positions, including critical vacancies at the Buffalo VA, the Trump administration imposed a hiring freeze, dismissing approximately 2,400 employees between February 13th and February 2024 of this year. On March 4th, a leaked internal memo revealed plans to lay off more than 80,000 of the VA's 470,000 employees, returning staffing to pre-PACT Act levels. Although the VA later claimed a reverse course on July 7th of this year, that commitment has now been abandoned. This past Saturday, the VA announced plans to eliminate up to 35,000 healthcare jobs, including doctors, nurses, and critical support staff, 23,000 more than what the agency said just months ago. Instead of addressing the deficiencies, this administration is exacerbating them. Cutting 35,000 additional healthcare positions will also only deepen the VA's workforce crisis, worsening access to care for veterans in my district and across the country. For an administration that claims to be pro-service member and pro-veteran, reality is telling a very different story. You cannot claim to support veterans while cutting the dedicated staff who care for them. You cannot claim to support veterans while delaying their benefits. You cannot claim to support veterans while ignoring the concerns raised by members of this committee. I want to be clear about the human cost. As an occupational therapist myself, I know the consequences of understaffing. Quality of patient care declines, burnout rises, and providers leave, not because they don't care, but because the system becomes unsustainable. When that breakdown occurs at the VA, it's our veterans who are paying the price with their lives. As members of this committee, we're entrusted to upholding this nation's promise to our veterans, not weakening it. These cuts that the Trump administration is making betray that promise. They're short-sighted, they're un-American, and they're deeply disrespectful to both the veterans who served and the professionals dedicated to caring for them. I yield back.